I would like to invite Dr. Rama Jayabalan, our Vice President of GCSMR, to introduce our speakers briefly. Dr. Rama, are you ready?
Um, uh, Vanakkam and greetings to everyone. It is my honor to introduce Dr. Anand Chokalingam, who is a professor of cardiology and director of cardiometabolic center at CAMC Institute since 2023. His research actually started at the University of Missouri with over 70 original publications in peer-reviewed journals, and his main focus being premature heart failure related to mental and metabolic stressors. He also collaborates with mindfulness experts, behavioral psychologists, integrative medicine, exercise, and nutrition scientists to improve heart failure outcomes. He has pioneered a very great thing called Heartful Living, which is intuitive cardiac energetics, which is called as ICE, a novel self inquiry, mindfulness, and technology based empowerment program for improving cardiometabolic health globally since 2015. And I'm sure he is going to shed more light about this heartful living during his talk. And he also works with American College of Cardiology and several medical associations for building physician resilience. ICE has demonstrated premature heart failure can be reversed, and he's the director of Diastolic Heart Failure Clinic at CAMC, where his team is studying this integrative approach for heart failure care through biological age reversal, which we actually need so much during this time. And his main research focus in his career is to investigate how to improve heart health with diet, fasting, and lifestyle. And he also is very curious to find out, are Indians at higher risk for heart attack and what can be done to reduce the risks. And also his main question is, how can ancient Siddha wisdom guide our journey towards real health and better living? We are happy to have Dr. Anand Chokalingam in GCSMR Scientific Advisory Committee. Without further ado, I invite Dr. Chokalingam to give us his expertise in fasting and heart health, which is much needed awareness all over the world, especially in our Indian community. Welcome, Dr. Anand Chokalingam.
Thanks so much, Ramamani, for a very kind introduction. I'll try to show and share some of the work we are doing in the next 15 to 20 minutes. And from there, Dr. Selva and me, after we are done, we'll be so happy to address any questions you have. To start off, let me see if you can see my slides. Are you able to see my slide?
Yes, we can able to see, Doctor.
Thanks so much once again. So today we will discuss an integrative approach using fasting for heart health. These are my disclosures. Several of my participants over the last 15 years in our Heartful Living program want to join us live, but because they are not able to, they have given us consent to share their stories, their pictures, so that people can understand the real impact that our program is having in our communities. We want to cover the obesity burden. What is biological heart age? Can it really be reversed? Is there evidence for that? And then how do all these things come together in heart health outcomes? This is the unfortunate reality in the United States. Obesity, which means body mass index is more than 30, was present in about 10% of the American population. Within the last 4 decades, from 10%, it has shot up all the way to 50%. This is not overweight. extra weight in the body means BMI is more than 25. So this is actual health issue called obesity, which is much more higher level. If you compare the developed countries that you are seeing here, European countries like Belgium or France, obesity levels are still around 10%, where it was in the US 40 years ago. But US stands alone, head and shoulders above the rest of the countries in this global lineup. Where does India stand? Unfortunately, urban India, where the cities, when we do the survey, we are finding we are very comparable to US levels already. So this is a very challenging situation when most of the countries you're seeing here are very affluent. Japan is one of the top 5 countries economically per capita, whereas India is still developing and we are already facing the major non-communicable disease burden. Again, there is one more challenge here. Rest of the world, to say somebody is overweight, the BMI has to be over 25. But for people of Indian origin, people can also be from Sri Lanka, Nepal, Bangladesh, South Asian countries. We are finding BMI of 23 is sufficient to cause the same risk for heart attack, stroke, and other problems. So why is this? We don't know the exact answer yet, but we have to be even more careful when there is extra weight in the body. So BMI of more than 30 is obesity. For Indians, 25, 26 is considered obesity. As a cardiologist, in the last 20 years, what is very humbling to me is the power, the role, and the potential of using the mind in understanding heart health. When we look at a simple understanding of this biological age, both the people you see here are 35 years old based on their passport or birth certificate. That is chronological age. But biologically, this gentleman is aged more. He's 40 years old. That means the rest looking ahead, his future lifespan, and then this other word called health span. Not only how long we live, but how long do we live healthy? That is even more important to us. So that also comes down. Whereas for this gentleman, although he's 30, biologically, 35, he is biologically only 30, which means he has a much longer, 10 years longer health span to look forward to. This is a huge difference. I want to share with you some of our success stories. This biological age was 63 for this patient of mine few years ago. Her chronological age is only 34. She weighs 230 pounds, which is about 110 kilograms. She has chest pain, which is called microvascular angina, and then a heart attack, but you cannot put a stent because there is no tight blockage. She has hypertension, depression, anxiety, post-traumatic stress, so many challenges, and she has come to our clinic for the last 10 years, every few months. Because I started taking care of her 3 years ago, I gave her this Heartful Living lifestyle change. She said, Doc, I've been dealing with too many things. I don't even know if I want to try this. Give it a shot for a few months. See if it works for you. This is what it did to her within 10 months. Her biological age is halved, come down to 30. At 2 years, she feels so much more fitness. Financially, she has so much more leeway because of the resilience coming from being more mindful. Now she's able to support her 3 teenage children and her family better because of this way of life. Fast forward 3 more years from the starting point, she perceives herself to be an 18-year-old, that level of energy she has. She is now about 37, 38 years of age. But think about how much this program could have impacted not only this one individual, but also her family. She takes it to heart. She is now certified in our course, and she is now teaching this to so many of her friends, family, and students in fitness. Another example, in 2021, the head nurse of our system came with heart failure, pulmonary hypertension, and challenges breathing when she walks even from one room to another. This is diastolic heart failure. We call it HFpEF. And within 10 months, her biological age has come down significantly, and her heart failure has actually resolved. She's not needing any heart failure treatment. Not only that, the high blood pressure medications that she was needing for the last 20 years, she's not needing that anymore. So, this might be the first instance where heart failure has been actually cured. Now it is 2024. I reached out to her and asked, because I moved to West Virginia. She has retired in Missouri, and she's spending time with her grandchildren. I asked her last month, how do you feel compared to at what age were you this healthy? Was my question. And she said, I thought she'll say she's as healthy as she was in her 40s or 30s. She said, I don't ever remembering in my whole life being this healthy. So that is her personal experience. This is the head of advanced cardiac rehab in Charleston. She's been doing this for the last 20 years. But for herself, when she practices this integrative approach, her heart age within 4 months has come down by 6 years. So she is loving the program. She is now hopefully going to reach so many more advanced cardiac patients with bypass surgery, stents, who are undergoing cardiac rehab to learn from these integrative methods. So, what are we doing in Charleston now? We have built the first diastolic heart failure center. When I was in medical school in Madras Medical College in the 1990s, this entity did not even exist. We did not know the heart can fail, although it is squeezing fine. So there are not many centers anywhere in the world that focus on these patients because it's so challenging for cardiologists to deal with it. We want to better identify, manage, and improve the health of diastolic heart failure patients. We have a refractory hypertension clinic where we have advanced procedures plus the integrative technology. We are training so many cardiology fellows, postgraduates to specialize in various aspects of this integrative approach. So this is what gives me a lot of confidence for the future when doctors trained in the Western system are simultaneously experts in teaching this type of integrative health. This is the last thought I'm going to leave you with before I pass it on to Dr. Selva to cover how to manage these challenges using Siddha wisdom. See, this concept was reported in the literature only in the last few months. The American Heart Association, which the entire world looks up to, is come up with this staging where to develop heart failure, heart attack, or stroke, 10 years earlier, there is already stiffness and blockages developing in the heart. 20 years earlier, there is what we call diabetes, hypertension, hyperlipidemia, metabolic syndrome. And even in teenage, we are seeing extra weight, obesity. Now, for the first time, is directly linked and is considered causative to all the problems that majority of our population all over the world is dealing with. Instead of metabolic syndrome, which we have known
What
for
is this?
several
What is this?
decades,
Akin.
can you please mute yourself?
Stop. Andrum po, andrum po. Stop. What is this?
Excuse me, please mute your phone. Sorry, doctor.
Tamarai might be able to mute everyone, but I'm going to just
We
continue.
can mute everyone, then you also get muted. So
That's okay. Then I can unmute myself, but that's fine. Now it's cleared out. Let's continue.
No, I have
Thanks,
muted, but some people are unmuting themselves.
So, this last concept is very, very important because metabolic syndrome we've known for last 3-4 decades, but this direct link with cardiovascular, kidney, and metabolic syndrome encompasses majority of people in the world. So it's not for a small minority who are at risk. Majority of people all over the world are at risk for these problems, and this is the number one risk for life and for health throughout the world. So this is how important extra weight is. I've spent the last 20 years of my life focusing on research into this specific area. What causes premature heart failure and how do we address it? So I think we have much more insight than what is evident from the slide. Here, this is a one-way street. somebody progresses to metabolic syndrome, then to atherosclerosis and heart attack. It just does not have a chance to reverse. But beyond stage 4, is there something worse than heart attack and heart failure and stroke? What is worse is being in the hospital, not being able to get discharged home and to go back to family and do things people want to do. That is not very clearly described. But we looked at specific people with that level of advanced illness, more than stage 4 that you're seeing in that picture. And what we used is, with the help of Dr. Selva Sharmagam, who is also here in today's discussion, to further discuss how fasting can be done. But we reported not only in heart failure, but also in refractory angina, refractory hypertension, and post bypass people having cardiac symptoms and heart failure and kidney failure. How in the hospital these integrative approaches can still give relief and potentially get people home. So this is what we reported in Missouri, and we are seeing so much more response here, because instead of me delivering it as wellness in Missouri, now we have a large team of 20 to 30 doctors, researchers, residents, fellows delivering this care in an integrative approach in West Virginia. So I said, beyond stage 4, there is a problem. Even in the beginning, it is not just lack of exercise or other things that lead to this. There is more to this. And at every stage, we have done good research to reduce the risk of heart problems, to reduce the risk of metabolic syndrome. Do we understand hypertension better? We've been publishing this now for 20 years. We don't have the time to go into details, but I want to say that in our approach, we've changed this, and we've added, along with CKM, mental stress. And instead of calling it a syndrome, we call it a dynamic, because it's not a one-way street, but it can be reversed. The pathway to reverse this is what we call Heartful Living based intuitive cardiac energetics. It's a very powerful program using virtual technology and Siddha consciousness that is so, what should I say, integrative and secular, that anybody, anywhere in the world can embrace it. We've got success in Australia, UK, Canada, India, obviously, because of English. That's all we need to reach people anywhere. There are many Arabian friends who are saying our programs are being translated there, but we are not offering care in Gulf yet. But what we are doing is working in heart failure, working in advanced heart situations where people are at risk of losing life in the hospital. Heart age or biological age reversal, we have gotten so good at it in the last 10 years that that is the key focus outside the hospital setting. And heart to heart is student empowerment programs that we also have. In this slide, what I wanted to share is, it's not just the obesity. Mental health is such a integrative part to this challenge, that unless we address mental health from the first initial stages, from teenage or even younger, we cannot reverse this cardiovascular kidney metabolic syndrome and long-term health. Medical, cardiac, kidney, all the organs put together is only 20%. The mind is 30%. The fitness and the socio-economic, the support is so important. It's about 50% of the health of an individual. So if you have somebody with heart failure who's lonely, cannot walk, he has lost his job and lost his family at 41 years of age, with 2 to 3 year risk of 75% losing his life. There is not much chance, even if he goes to advanced centers like Mayo or Cleveland, to do a heart transplant, because the comorbidities are so high that surgery will only risk his life even further. So when this gentleman started our program, within 1 year, he is showing us how much our results can be. It's the same gentleman in 10 months. So I want to thank all my collaborators over the last 20 years who have helped me develop this program. You will see Siddha physicians and psychologists and technologists here who have helped me. And at the end of the day, we want to remind people that lifestyle is not regarded highly, because Western science says it has got only 5 to 6% weight reduction, whereas the latest pills can give 25% weight reduction. surgery even up to 30% weight reduction. Whereas when we use mindful consciousness-based virtual technology in ICE program, we have up to 60% weight reduction, which is beyond everything else that we know in the Western system. Obviously, anything is going to work only in a certain group of people. For our program, it worked in about 10 to 15% of all comers 15 years ago. Now our success rate in heart patients is close to 90%. They're able to impact. In younger populations, when they are not that motivated, our success rate is probably going to be about 50-60%. So this is what we bring to our work in the US. It's not just happening in the US. In a remote village in Tamil Nadu, this gentleman started the program 4 months ago at 188 kilograms. 4 months later, he's lost 40 kilograms and he's just beginning our program. So his real success you will see in 1 to 2 years. And he's only 34 years of age. So the impact it has on his entire family, not just himself, is what gives us confidence that thanks to the support of ancient traditional wisdom and working with Dr. Selva Shanmugam, Dr. Arul Amudan, and some amazing people who are supporting our work with technology, we are able to offer this at a global level. So this is the next program that is coming up, Intuitive Cardiac Energetics, specifically for doctors, but we are welcoming anybody who feels a lot of stress in their life. It is offered from two of my friends who done this program over the last 5 years, Dr. Pravda and Dr. Anuradha. The cell phone number is there if anybody is interested. This is going to start on Saturday evenings in India time, and it will run over the next 2 months, where virtually you join us and learn these methods, enjoy from it, and see how to make it work for yourself. And we will guide you not only with the live interactive sessions, but also with the right technology to support the mind and the body in this transformative, fun self-exploration. Thanks so much for giving us this opportunity to present our work. Glad to answer questions.